road with a in a road with a traffic block, you cannot drive easily or quickly, but in an expressway you can. Similarly, when the body is purified, the medicines will be more bioavailable, because it's important, because we don't get the benefit of what we eat or what the medicine we eat. We get the benefit of what our body absorb and assimilate. Yeah, now I will just, scientifically, I will, very simple way, I try to explain how the mode of action of Pura Karma basically. We do Pura Karma before Panchakarma. For example, Snehabana, Abhyanga Sveda, then Virajana Vamana. Okay, then even for Vasti, initially we give some heat treatments, Potli massage or Pidchilkaya Sega or Abhyanga Sveda. Then we go for Vasti, Sneha Vasti and Kashaya Vasti. Why so? See, the heat treatment, the therapy is basically, for example, Potli massage. It is actually heat stress on the body. When a heat stress is applied, there will be vasodilation. In a cold stress, there will be vasoconstriction. In a heat stress, there will be vasodilation. So the blood flow to the our periphery will be more, extremities will be more. So 1 hour treatment, so blood flow to, due to vasodilation, blood flow to the extremities are happening. After that, we are asked the patient to take rest. So the heat stress is withdrawn. The body has to maintain the thermal homeostasis. So what will happen? Vasoconstriction, blood flow to internal organs will be more. So what will happen? Waste excretion to gut will be facilitated. Then we do like Virajan Aushadas given, Vamana, yeah, Vasti, we are clearing. In a very simple way, बर्तन वॉश करते वक्त हम पहले डिटर्जेंट लगाते हैं ताकि वो डर्ट डिटैच हो जाए, देन टैप वाटर में क्लीन करते हैं. Same concept. And motor vehicle service, we all do our servicing our vehicle periodically, but not our body. So the periodic panchakarma is just want to let you all know the importance of periodic panchakarma. I don't know, like you all practicing physician might be referring many patients, but how many of you have done panchakarma? So I'm not able to see. I'm just I'm not changing the screen sharing part. So if not, because panchakarma can be done for preventive, curative, and promotive. The Rudu Shodhana, Karkataka Chikitsa and all, the Rudu Shodhana for maintain health. Curative, obviously, for curing diseases, like depending on the disease condition, we do Panchakamasti, Vamana, Virajana, whatever needed. For promotive, Rasayana and Vajikarana. So a Swastha person can also take Panchakarma, also a person with the disease, depending on the necessity and condition in a proper time. So even I recommend the Ayurvedic physician also to do periodic Panchakarma or experience it, so that then you will be able to clearly explain the patients also, whatever needed, obviously. Now, the benefits of Panchakarma, basically improved immunity, detoxification, enhanced digestion, increased energy level, and improved skin health, overall physical and mental well-being. Now, we'll just quickly discuss a case study of a lichen planus, a 55-year-old lady lichen planus, basically blackish spots all over the body with itching, oozing, and scaling, gradual onset. So, this is the condition during admission. This is a case treated at our charitable hospital. It's a properly documented case. So, okay, she was on topical steroids. Bowels and other things are clear. Vitals are okay. First, Deepana Pajana with Vaishana Churna is given. Peya was given. In North India, you can give Khichdi, Dalia, like that. And Snehapana with Tikta Grudam. 7 days. Then, following Abhyanga Sweda, Eladi Kerataila used. Then, Avipatti, Virajana. Here we mostly with probably here or more conditions. So 7 Vegas. Sometimes the Vega usually 20 Vegas, 15 Vegas are required. So here the condition. And then following that, we need to address the Peyadikrama. Peya Vilebi. Proper Peyadikrama is very important. Peya Vilebi, Agradam Kradam Cha Yusham Dasam. Tridhi, Egasasya. Kramena Sevadaran. The classical way, basically. Following that, after that they need to start the medicine. The medicines are Aragadadi Kashayam, Kaishoro Gulu, and Gulujiyadi Kashayam and the Avipatti Churnam. Now, then again admitted for Abhyanga and Aragrada Takradara, which I explained earlier, Takradara. Abhyanga with Eladi Kera Thailam and on head application, and Panchavalkali Thailam for this. Following Yoga Vasti with the Sneha Vasti was the Tikta Grada, Pajita Grada, and Panchatikta Kashaya Vasti, PTV, Pajita Kashaya Vasti for 3 days. And the condition discharge at the time of the itching and scaling reduced up to 60%. At the time of discharge, we can see the change. Then follow up again, same medicines given. Kimshuka Patradi was given for body. Okay. Now after 2 months, then after 4 months. So now there is like Yuganuruba Sandarbha because the period is changing. We need to attract the young generation also to Ayurveda. So this is a new product, face sheet mask. Because see, young people, working people, they applying Gongomadi and other things will be very difficult. So in Ayurveda also we need to modernize Ayurveda, Yuganuruba Sandarbha. So this is actually a face sheet mask which contain saffron, Padmakesara, and fractionated coconut oil. That fat is removed for more penetrating property, and aloe vera extract and milk. So फेस को पूरा क्लीन करके जैसे ड्राई करके जस्ट लगाना है एक आंखें बंद कर कर एक प्लेलिस्ट में कुछ मेलोडियस म्यूजिक 4 गाना सुन सकते हैं 20 मिनट ड्राई होगा देन आपको रिमूव करना है देन ये सीरम यू शुड नॉट वॉश सर्कुलर मोशन में रब करना मे बी द पाउच में भी थोड़ा सीरम रह जाता है विच यू कैन अप्लाई एंड ये एक नाइट रूटीन जैसा आप यूज कर सकते हैं द रेकमेंडिंग इज वंस ए वीक एटलीस्ट now again skin serum similar kind saffron, lotus, manjishta, sandalwood, and again fractionated coconut oil. You daily 2-3 drops, gentle massage 3 to 5 minutes, apply daily. And this actually maybe 6 days for a better health serum, 6 days, and 1 day face sheet mask. Extreme oily skin with pimple, that is contraindicated. Other conditions can use it. Also recommended as a night routine. Now it's time for concluding our session. I hope आप लोग बोर नहीं हुआ and something एक ना एक बात नया मिलने सीखने के लिए मिला होगा I hope and you are able to follow me I believe. Now see Ayurveda views the skin as a reflection of internal balance involving dosha, dhatu and agni. Skin diseases are जैसे अब बताया था स्किन की इंटरनल हेल्थ को रिफ्लेक्ट करते हैं स्किन देन रसरक्ता दुष्टि को भी स्किन में हम वी विल बी एबल टू फाइंड नाउ a holistic approach shodhana shamana even rasayana and lifestyle correction okay आजकल we see our poor lifestyle erratic diet pattern mental stress all these may be a reason of the increasing number of skin conditions so and okay integration of modern diagnosis with Ayurvedic principles is again that will enhance patient care and outcome and there is obviously there is a need for documentation more research and collaborative practice to validate and promote Ayurvedic dermatology globally because when we talk about CME I believe there is a thing Tadudya Sambhasha Jnana Vardhanana. I'm sharing my experience our knowledge minimal knowledge many experts are in the audience they will be sharing their experience their expertise so we will be the knowledge will get shared now let's see I request everyone with just 2-3 minutes I will take and will then we'll be open for discussion yeah the name doctor actually is there is a Latin word called docere. Docere means to teach. From them, the word doctor is originated. A good doctor treats illness. A great one touches lives, not only with medicine, but with mindful words and meaningful guidance. I thank everyone for a patient listening. This is our Karkaduma Hospital Delhi. Labhanam Shreya Arogyam. Of all the gifts, the most precious is health. I wish everyone health and happiness. Once again, thank you so much for a patient listening. Now I will stop screen share. Okay. Now we can listen from our experts in the audience.
हेलो हाँ जी सर सर थोड़ा सा जो क्वेश्चन वगैरह रहेंगे वो आप कर सकते हैं इस टाइम पे.
So we are for the question answer session.
I hope everyone that like आप लोगों को मैंने बोर नहीं किया and something कुछ ना कुछ एक चीज तो नया सीखने को मिला होगा. I hope.
जी जी सर, अभी हम पूछते हैं अपने ऑडियंस से. तो भाई we are open for the question answer session. Anybody wanted to ask any question, please come forward.
डॉक्टर तेजस.
तो एक ने पूछा है सर, डिफरेंशियल यूज ऑफ बिलवादी गुटिका वर्सेस दूसरी विषारी गुटिका.
दूसरी विषारी में भी mostly acute cases will be more effective. दूसरी विषारी for chronic. दूसरी विषा means old chronic conditions. दूसरी विषारी is widely recommended. अब acute कुछ हो गया विलवादी में, सिंपली स्पीकिंग, बट आप दोनों कंडीशन में यूज कर सकते हैं, ठीक है. बट क्रोनिक कंडीशन, डीप रूटेड कंडीशन, ओल्ड कंडीशंस वो दूसरी विषारी. इंग्रेडिएंट वाइज भी डिफरेंस है.
एक बार सर बुक के नाम दोबारा दिखा दें, वो डर्मेटोलॉजी वाली.
अच्छा, बुक का नाम है, इट इज रिटन बाय डॉक्टर पीएम मधु. इट इज एक्चुअली, I will just tell you. Two books are there actually. The new books is clinical diaries in Ayurvedic dermatology. Clinical diaries in Ayurvedic dermatology. Dr. P.M. Madhu. And it's the first book was consultations in Ayurvedic dermatology. The clinical diaries actually, it is like an investigative story. In fact, that is the beauty.
So
it's beautiful writing.
Sir, they are in English or Malayalam?
English. Luckily in English.
Okay.
Clinical diaries in Ayurveda.
Next question is hyperpigmentation. What will you recommend for hyperpigmentation?
Okay. Because hyperpigmentation, different conditions we need to see. There is nothing like a single without. See, every skin condition when you treat, you need to see the patient. You need to see. Obviously, first you need to do a shuddhi, a shodhana, and following that, medicines like manjishtadi are widely recommended. Manjishtadi, depending on the condition, other medicines you can use, and our medicines like Vibha and Vibha skin cream is again. Now, Kalyana Kashayam. Okay, chat. There are questions. So, Vikas ji is Dr. Tejas ji. I think उन्होंने बोला maximum participant हो गया. So I think अभी मैं एक और बार बोल देता हूँ. Yes.
Yes.
So treatment for pemphigus vulgaris, sir.
Pemphigus vulgaris, again a very difficult to treat condition. See, Panchakarma, you can improve the quality of life. Shodhana is required. So for Shodhana, you need to see the patient's age and associated conditions. Okay. And Aragadadi Kashayadhara, Aragadadi with Trufala Kashayadhara. See, when we spoke about the conditions, I spoke about psoriasis, so medicine. See, it's not like different stage you need to make a different treatment. But obviously, again, for an understanding, Aragadadi Kashaya and Dara, Aragadadi plus Trufala Kashaya Dara can be recommended. And medicines, depending on the stage, Aragadadi, Mahatikta Gridam sometimes, okay, and even Nimba Amradadi Panchatiktagam, it can be given.
Treatment for melasma.
Melasma, I had a case basically. Melasma, again you need to see first you need to give you can give Krimignavadi Krimishodhini followed by Avipatti for a periodic cleansing initially. Hormonal changes, stress, other factors you need to understand. Obviously diet and other things you need to correct. So first you do a Shuddhi, then you can give Manjushtadi, Aragadadi depending on the clinical condition. External applications you can give them like Kungumadi, even the serum can be tried. The face new our saffron serum can be given. Internal medicine, Manjushtadi, Kaishorogulu, Aragadadi, all these things, depending on the stage. Okay.
So, any other question by anyone?
And I would like to listen to, because many audience, so everyone
There
will have some of unique experience. So they might be having, like maybe regarding medicine, regarding see, one I will tell you, like Mahatikta Gridam. Mahatikta Gridam eyes condition में, like a myopia condition, prescribed Mahatrifla Gridam. Accidentally, by mistake, dispenser से Mahatikta Gridam दिया. And 1 month में patient काफी improvement condition में, clinical condition. तो ठीक है, तो महातिक्ता कंडिशन, महातिक्ता के चक्षुषिया. Even the primary thought was Mahatraifala, but Mahatiktaga also the importance in so many some unique experience. I invite other doctors also to share their experiences.
There is question by Dr. Sucheta Sani. Treatment for
Okay.
urticaria where IG is raised.
IG, sorry, treatment for chat.
Urticaria where IG is raised.
IG, mostly IG or the allergic condition IG. See, we don't treat like to bring down the IG. The IG is raised because of them. So the treatment for urticaria and condition, obviously you need to see the analyze the dosha. A Shuddhi, some chronic condition, you can go for a Shuddhi if it is very chronic. Otherwise, medicine treatment, see the Paitiga kind of thing, then the yogas, Mahatiktaga, Gulujyadi, Gopi Chandanadi, Haridra Ganda, a periodic cleansing with Avipatti, this will be helpful. If it's itching, is that sometimes Aragadadi Kwada also you can use. Even Villuadi Guliga you can use wisely in urticaria, treating urticaria. And see, for example, if, one patient, they may be on cetirizine or antihistamines, for example, whenever they have it will vary because the intensity, frequency of urticaria vary. People will be every day, sometimes the outbreak maybe in once a week or like that. So when there is an outbreak, they may be taking antihistamine. They may use to take. In that case, it's better let them take antihistamine. When there is a severe outbreak, you give them the medicine. What will happen? The intensity, frequency gradually reduces, gradually comes down. So the requirement comes down, because sometimes if outbreak happens, it may not be completely controlled with our medicines. If they are chronic cases, they may be used to antihistamine for a period of time in that case. So you need to, like, start your medicine. Then there is a severe outbreak, severe itching, let them take antihistamine 1 or 2 days, subside. You modify their, advise them healthy diet practice, lifestyle change. You give the medicine. Mahatiktaga, Gulujyadi, Gopi Chandradi, Aragadadi, Villuadi, Haridra Ganda, periodic Avipatti. All these are common medicine. You can select from this pool depending on the clinical condition.
Dr. Kiran, good evening. I have joined.
Dr. Tejas, welcome. So, Dr. Tejas, a senior Christian. So, any more questions? Dr. Tejas have an extensive clinical experience. Doctor have experience in the regarding medicines and all. Now I am like, any more questions? We have an expert to answer.
There is a question by Dr. Gagan. Patient has blemishes during pregnancy. After 2-3 of delivery, patient still has blemishes. What you recommend, sir?
I think Dr. Tejas will answer.
The blemishes, definitely the new product, saffron silk is advised, as well as something which is, Pitta Shamana Pitta Gradam capsules. Mahapitta Gradam capsules are there. She can have one capsule morning and evening, and she has to reduce the amla kadu lavana things in the diet. That is very important. When we treat the skin disease, diet is very important. That we must remind every time. Dadi dugda masha guda anuba mamsa amla kadu lavana viruddhana pishtana abhishanti food has to be avoided. Then only we will get the intended result. Otherwise, we will not get the intended result. We are using Mahapitta, everything in proper dose and all, but we will not get any result. You must stick on the dietary restrictions. Then only you will get the good result. And always drink plenty of water according to your body weight. That is also needed for a good healthy skin. For every 20-25 kilo weight, you have to drink 1 liter every day. 50 kilo means 2 liters. If you are 75 kilo weight, you have to drink 3 liters of water every day. This type of dietary modification also has to be implemented in the lifestyle of the patient. Then definitely you will get the result.
There is a question by Dr. Atul Garg, treatment of dermatomycosis, round red itching patch on the skin.
That also the symptom is kapha pika. Itching is more than definitely kapha shamana drugs you have to select. And in every itching condition, you can always go for Triphala Kashaya Chalana. That will be better. Or Aragodadi Kashaya Chalana externally. After that only you can go for Pitta Grada, Mahapitta Grada type of drugs you can select. Always go for a Pachana drugs which include, Kiran already told you, the Ilyadi Guliga and Padala Kadu tablets, all these things. Basically, all are related to Vishaja Ama. All skin diseases are related to Vishaja Ama, and all these Dushi Visha, Garavisha, involvement will be there. Definitely, you can go for Maha Ittangashayama as well as Vilati Gulika, Aragodapia, Aragodarishtam, all these type of medicines, and along with the proper dietary restrictions, and go for Triphala Kashaya Chalana. After that, 1 week Chalana and all, then you can apply the oil external application like Parandhyadi Kerataila and Neelidaladi Taila, even Eladi Kerataila. All these type of oil applications should be done after the Amapachana and Pranashodhana or this external application. Afterwards only you can apply the oil. Then only you will get the good results.
Gandhagam 21 also, one medicine
Yeah.
for the condition. Gandhagam,
Gandhaka
Gandhagar
Thailam
Sayam,
also is there. Gandhaka
Gandhaga
Thailam also
Thailam,
is out there.
and also capsule.
Even Kimshiva Patrati Keratailam also got a Gandhaka.
Yes.
Even you can externally apply when infestations or any tinea type also this you can apply the Gandhaka Thaila, Kimshiva Patrati Kerataila also. After Triphala Kashaya Chalana you can apply, then definitely you will get good results.
Okay, sir. One question is also there, treatment for pyoderma gangrenosum.
Infection.
Pyoderma, if it is a cellulitis or that the severity you have to assess, accordingly only we can treat. If the more area is covered or all the things are, then definitely go for antibiotics. Otherwise, small areas are there, then definitely we can go for Ayurvedic treatment. It's the Mahapitta Kashaya and Gugulu Panchavala Churna, Kaishora Gulu type medicines you can give. And always stick on to dietary restrictions when you treat these type of diseases. Acute diseases definitely need a proper dietary restriction. Otherwise, you will not get any result and you will aggravate the condition and the patient will blame you.
You need to assess modern problems. See, you need to assess the dosha correctly. because
Yeah.
modern terminology. That's why the cologne spray case, which was allergic contact dermatitis. See, the thing is that we need to assess the doshas correctly. That is important. See, sometimes it's not like even psoriasis. सोरियासिस के लिए एक मेडिसिन ऐसा नहीं है, क्योंकि सोरियासिस में जो कंडीशन होते हैं वो डिफरेंट है, गटेट में थोड़ा डिफरेंट होगा, पामो प्लांटार में थोड़ा डिफरेंट होगा। तो हमें एक आयुर्वेदिक अप्रोच के साथ इसको ट्रीट करना बहुत जरूरी होगा, क्योंकि इवन हम एक्सिमा का जैसे डिस्कस किया था उसमें, या एटोपिक डर्मेटाइटिस डिस्कस, सर्टेन कंडीशन देयर विल बी ऊसिंग कंडीशन अप्रोच में बी डिफरेंट. It will be atopic dermatitis only. Some conditions you will see the dry stage, then the treatment may be different. So dosha assessment, because here the nidana parivarjana, clear understanding about the dosha and treating accordingly. Sometimes very modern conditions we can give because the colon example is modern problems have classical solutions if we understand it properly scientifically.
You are very right, sir. We have to assess the doshas.
Even
Then
the
only we can treat
Mahakushta, all are treated. Sorry. Mahakushtas are all treated with the treatment principle which is mentioned in Ashtanga. Pakshat Pakshat Tardanam Abhivaya Masad Masad Chodanam Apyadastad. Shuddhir Murdini Syat Triratra Triratra. Shashte Shashte Masa Sasrik Moshanancha. This frequent cleansing, bio-cleansing is required in all Mahakushtas. And this psoriasis, eczema, lichen planus, all type of these things definitely need these type of Shodhana Chikitsa frequently. So that will be more alleviating result and pacifying the doshas, and normal skin condition will take place in a gradual manner. Sometimes it won't get good result in first course of treatment. Definitely, if the patient takes the next course, definitely he will get more result. Even these stress factors also he has to address. If the patient is more in stress condition, definitely even after curing the psoriasis also, the disease recurs. So definitely stress factor you have to address, and the meditation type, this yoga nidra type, all these things you can advise, because all skin diseases are psychosomatic in nature. The Ashtanga again advises example Aptajya Kathayoriva. Even one pot with hot ghee, the hotness will transfer into the pot, and if the pot is hotter condition, when we put a ghee on the pot, the ghee also got heated. So this type of mind and body relation definitely you have to address, and stress nowadays professional in everywhere, work field, everywhere there is stress. So this stress has to be managed adequately, then only the skin disease also will get cured.
Okay, I think, sir, there is no more question. So we are going to close the session, sir. I am thankful to all the doctors, Dr. Kiran, as well as Dr. What is the exact pronunciation, sir? Tejas Mehan.
Dr.
Yeah.
Tejasimhan. Tejasimhan.
Tejasi Mahan. Okay, sir. So we are very thankful to you that you have agreed to come on the platform of Parampara. This is the organization which is in the Punjab, and we are working very hard to propagate Ayurveda. So thank you very much. We will meet again, sir.
Happy to be a part. Thank you, Dr. Amitpal Singh, and thank you, Dr. Tejasimhan. Thank you, our IT department. Thank you, Vikas ji, Ashok Kumar ji. And I once again thank all audience for a patient and active listening. It was a wonderful session, I hope, for me, in fact. And I hope it served the purpose which I told earlier. Thank you once again.
Okay, thank you very much.
Thank you, Doctor. Thank you, sir. Thank you so much. Thank you, Dr. Amrit Gill.